Did you know that in the medical field, over 60% of errors come from miscommunication? And that can happen between doctors and nurses, during shift changes, or even between staff and patients. And while that's already a major issue, it can even be a more serious in long term acute care facilities, where patients often stay for longer periods and rely heavily on clear updates about their conditions and treatment. When communication is unclear, patients can feel confused about what is happening, what the plan is, or even who is responsible for different parts of their character. Over time, that can turn to frustration or even a lack of trust. And that was a problem we wanted to look at. Not just how miscommunication happens, but what it feels like for patients when they are left out of the flow of information. That question became a starting point for our project.
At first, we thought the problem was mostly happening between medical staff, so our early ideas focused on improving communication between doctors and nurses. That seemed like the obvious place to start, but as we researched more, we realized we were looking at only part of the problem. Patients were being affected directly. In some cases, they weren't getting clear updates. In others, they understood pieces of information, but not the full picture. It changed how we thought about the project. Instead of only asking how staff communicate with each other, we started asking how patients stay informed. And once we shifted our focus there, our whole direction started to change. What began as one kind of solution became something very different by the end.
To understand the issue better, we use both outside research and our survey data. So in our survey, half of our respondents said that they had seen miscommunication happen in hospitals and clinics, and everyone we surveyed agreed that it affects patient safety. It was something people was had actually seen. We also looked at research related to patients' experiences in long-term care. A lot of complaints had to do with communication. Patients talked about feeling unaware of what was going on and not having enough information to understand what their care was about. And that helped us realize the problem was just not where the information exists. I feel like that's a big thing, bro. That's a big thing. It was where the patients could have to access to clear and consistent way so that they became really important in shaping our final direction. So because once we understand the problem more clearly, we could start building a better solution.
One of our early ideas was based around AI transcription. We thought maybe a system that could capture conversations and then automatically turn them into text. But at first it sounded promising, but as we worked through it, we started seeing problems. The accuracy was inconsistent, and it made the system more complicated. So we just started to notice that did not solve the main issue we're trying to address. The problem was not simply recording more information. It was making important information clearer for patients. This realization caused a major pivot within our project, and we moved away from trying to automate conversations and started focusing on how information could be organized and shared better, and that was a big pivot point in our project.
That shift led MedSmart to a two-part software system. The first part for medical staff, doctors, nurses can enter day-by-day information about a patient, including updates, notes, and care plans. Instead of information being scattered, it can be organized in one place.
The second part is the patient displays. This is the side patient that would actually see. So it takes important information from the staff portal and presents it simple and clear to read The goal is not to overload patients with everything. It helps them to understand what matters most.
That includes helping patients keep up with changes over time, not just what is happening in a single moment, but how their care is progressing per day.
As we developed the prototype, we focused a lot on simplicity. Some earlier versions had more features and more visual elements, but we realized that made things harder to use, so we simplified it. We focused more on readability, organization, and making the interface feel clear. And that became one of the biggest lessons for us throughout the design process, because sometimes adding more to it does not improve the solution. Sometimes removing complexity does. So that idea shaped our final prototype a lot.
We believe that what makes the solution meaningful is the way that it works to support information, creating a clearer way to share it between staff and patients, helping to bring them back into that process that they can sometimes feel excluded from. It matters because communication isn't just about passing information, it affects trust, understanding, and how patients experience care. That's what we wanted this project to focus on.
There are still limitations to our product. We haven't tested it in a real hospital environment.
And it is still a prototype.
But it helped us understand the problem better.
And it helped us develop a solution grounded in what patients actually need.
At the end of the day, MedSmart is about clarity. It is about helping patients understand their care, about making communication more consistent. Because in healthcare, communication is not just important, it's necessary.